the study was designed to test if increasing plasma potassium from low normal levels, I mean within the normal range for plasma potassium, to high normal levels, if that would decrease the incidence of cardiac arrhythmias and hospitalization for cardiac arrhythmias and death. The study was a randomized and open and controlled trial. 1,200 patients were randomized to an increase in plasma potassium in addition to standard care or to standard care alone. And after that, they were followed up every 6 months. We increased plasma potassium by using mineralocorticoid antagonists, potassium supplements, diet education in potassium-rich diets, and we decreased diuretics if it was possible. And we increased plasma potassium by 0.3 millimoles per liter, and that resulted in a reduction of the primary endpoint of 24%. So the primary endpoint was mainly driven by a reduction of ventricular tachycardia of 25%. There were no difference in mortality events, and we did not see an increased risk of hospitalization for renal failure or other electrolyte disturbances. So you can increase plasma potassium by eating potassium-rich diets. These include green vegetables, beans, roots, and so on. But the amount of potassium-rich diets you would have to ingest is too much for most people. That's why we also use potassium supplements, and we stopped potassium excreting by adding potassium-sparing drugs if we had to. So we used any trick we could, and we still need to see. There's a lot of difficult. A lot of different combinations in the trial, and we are still analyzing of which if all combinations were equally good in increasing plasma potassium.